Hello all, welcome to Lucid Means. Today we are going to discuss about the Sustainable Development Goals from the Indian perspective. This assessment is based on the recent SDG India Index Baseline Report 2018 released by Niti Aayog. And here we are trying to cover this topic in a comprehensive way which you could use for your general studies papers including ethics and for optional papers like sociology, public administration and so on. This is the third part of the series in which we will try to cover two goals, and we will go to the remaining ones in the coming parts. Okay. So let us start with goal 3, good health and well-being. This SDG is closely interrelated with goals 1, 2, 4, 5, 6, 10, 11 and 12. It aims to ensure that people enjoy a level of health that enables them to lead a socially and economically productive life. It also aims to end preventable deaths across all ages from communicable and non-communicable diseases and illness caused by air, water and soil pollution and contamination. It ensures that all learners acquire knowledge and skills needed to promote sustainable development. It also aims to achieve universal health coverage, including financial risk protection, access to quality essential health care services and access to safe, effective, quality and affordable essential medicines. It also calls for renewed focus on mental health issues. And the best performing state and UTs in goal 3 are Kerala and Puducherry. So what are the targets? First, by 2030, reduce the global maternal mortality rate to less than 70 per 1 lakh live births. Then by 2030, end preventable deaths of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1000 live births and under 5 mortality to 25 per 1000 live births. Next, by 2030, end the epidemics of AIDS, tuberculosis, malaria and neglected tropical diseases and combat hepatitis, waterborne diseases and other communicable diseases. Also, by 2030, reduce by 1/3 premature mortality from non-communicable diseases through prevention and treatment and promote mental health and well-being. Next, strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. Next, by 2020, halve the number of global deaths and injuries from road traffic accidents. Seventh one is by 2030, ensure universal access to sexual and reproductive health care services, including for family planning, information and education, and integration of reproductive health into national strategies and programs. Eighth one is to achieve universal health coverage, including financial risk protection, access to quality essential healthcare services and access to safe, effective, quality and affordable essential medicines and vaccines for all. Next, by 2030, substantially reduce the number of deaths and illness from hazardous chemicals and air, water and soil pollution and contamination. Also, there are 4 sub-targets, and the first one is to strengthen the implementation of World Health Organization framework Convention on Tobacco Control in all countries. Next is to support the research and development of vaccines and medicines. Next is to substantially increase health financing and recruitment, development and training and retention of the health workforce in developing countries, especially in least developing countries and small island developing states. Last one is to strengthen the capacity of all countries, in particular developing countries, for early warning, risk reduction and management of national and global health risks. So where India stands in goal 3? First, in maternal mortality ratio. Maternal mortality ratio MMR in India stands at 130 per 1 lakh live births. The SDG target is to reduce the MMR to less than 70 per 1 lakh live births. 3 states, namely Kerala, Maharashtra and Tamil Nadu, have achieved this target at 46, 61 and 66 per 1 lakh live births respectively. Then we are going to look at under 5 mortality rate. For every 1000 live births in India, 50 children aged under 5 years die. The national target is to bring this rate down to 11 per 1000 live births. Kerala is the only state to achieve this target. Goa among the states and Andaman Nicobar Islands among UTs are nearing the target, with under 5 mortality rates nearing 17 per 1000 live births each. Next one is immunization coverage in children. 62% of children aged 12 to 23 months are fully immunized in BCG, measles and 3 doses of prevalent vaccines. The national target is to increase this rate to 100%. No state or UT has achieved this target yet. Highest immunization coverage is observed in Punjab with 89% among the states and Puducherry with 91% among the UTs. Next, in tuberculosis incidence. About 138 cases of tuberculosis are noted annually per 1 lakh persons in the country. The national target is to completely eradicate tuberculosis by 2025. The lowest incidence of tuberculosis is noted in Tripura, that is 44 cases per 1 lakh among the states, and Lakshadweep Islands, that is 70 cases per 1 lakh population. Next, about health workforce. There are roughly 221 government physicians, nurses and midwives per 1 lakh of population in India. This rate is highest in Kerala at about 762. Delhi is the best performing among the UTs with about 344 health workers as per 1 lakh population. So what are the Government of India initiatives for Goal 3? Here we are only covering the most important flagship schemes on the go, but you can find the ministry-wise sorted list from our material. So please go through the material to find that bunch and it will help you a lot. So first about the National Health Mission, which encompasses two submissions, that is National Rural Health Mission and National Urban Health Mission, which aims to provide universal access to healthcare by strengthening systems, institutions and human resource capabilities. Next one is Ayushman Bharat, that is Pradhan Mantri Jan Arogya Yojana, is a national health protection scheme which aims to provide coverage up to 5 lakh rupees per family per year for secondary and tertiary care hospitalization, covering 10 crore poor and vulnerable families. Next one is Mission Indradhanush, aims to increase full immunization coverage in India to at least 90% children by December 2018. For non-communicable disease control, a number of schemes are in place. Revised National Tuberculosis Control Program aims to improve the success rate of treatment among sensitive TB cases. National Leprosy Eradication Program aims to reduce leprosy cases. Integrated Disease Surveillance Program aims to monitor disease trends and to detect and respond to outbreaks in early rising phase. National Mental Health Program aims to improve the access of mental health care services. National Program for Control of Blindness aims to reduce the cases of blindness. Also, National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases and Stroke aims to reduce premature mortality and morbidity from these diseases. So, how India is going to achieve the target? First is about financial commitments, that is, India should increase its budgetary allocations towards health. Next one is increase public spending on health to at least 5% of GDP. Factoring in inequities and vulnerabilities, that is, leaving no one behind, implies reaching out to neglected populations using different strategies to address their unique concerns. Track the progress of marginalized communities towards the goal. Next one is reporting, transparency and accountability. That means require a robust and reliable monitoring system as well as a strong accountability mechanism. Provide publicly financed health insurance through an accountable, rational and regulated healthcare system. Innovation and research to be conducted in these areas to further enhance public policy efforts. Ensure that ethical and medical standards of care are strictly adhered to and implement quality assurance mechanism as laid down in the policy. Ensure universal access to healthcare and to make medicines and vaccines affordable. India should focus on mental health issues. Increase participation of communities and civil society organizations in different stages of policy and program formulation, implementation and monitoring should be there. For example, through inclusion of CSOs in technical and decision making bodies, capacity building of community volunteers and social audits of the program. India should align human resources policies with principles of human rights, including policies for HIV or AIDS. Also, use already existing resources for guidance. India should partner with healthcare NGOs and public clinics to raise awareness and increase access to targeted health services for women and men and their families. India should make investments in health a priority in business operations. India should facilitate and invest in affordable medicine and healthcare for low-income populations. Leverage corporate resources to support healthcare delivery by public and international organizations, that is in R&D, distribution, cold chains, etc. So that's it for goal 3. Let's move on to goal 4. Goal 4 is quality education. This SDG is closely interrelated with goals 1, 2, 3, 5, 6, 8, 9, 10, 12 and 13. It aims to ensure inclusive, equitable and quality education for all, including technical and vocational training by providing lifelong learning opportunities so as to achieve substantial adult literacy and numeracy. It also aims to build and upgrade education facilities that are child, disability and gender sensitive and ensure that all learners acquire knowledge and skills needed to promote sustainable development. The best performing state and UT in this goal are Kerala and Chandigarh. So we will look at the targets. First one is to ensure that all girls and boys complete free, equitable and quality primary and secondary education leading to relevant and effective learning outcomes. Next, by 2030, ensure that all girls and boys have access to quality early childhood development, care and pre-primary education so that they are ready for primary education. Next one is by 2030, ensure equal access for all women and men to affordable and quality technical, vocational and tertiary education including universities. Next one, by 2030, substantially increase the number of youth and adults who have relevant skills including technical and vocational skills for employment, decent jobs and entrepreneurship. Fifth one is by 2030, eliminate gender disparities in education and ensure equal access to all levels of education and vocational training for the vulnerable, including persons with disabilities, indigenous peoples and children in vulnerable situations. Sixth one is by 2030, ensure that all youth and substantial proportion of adults achieve literacy and numeracy. Next is by 2030, ensure that all learners acquire the knowledge and skills needed to promote sustainable development. Also, there are 3 sub-targets and they are: first one is to build and upgrade education facilities that are child, disability and gender sensitive and provide safe, non-violent, inclusive and effective learning environments for all. Second is by 2020, substantially expand globally the number of scholarships available to developing countries. And the third one is substantially increase the supply of qualified teachers. So, where India stands in this goal? First, in enrollment ratio. 75.83% of eligible children are enrolled in the schools at elementary and secondary levels. All states and UTs are yet to achieve this target of 100% enrollment. Among the states, Tripura has the highest enrollment ratio of 94.72%, while Delhi leads in UTs with an enrollment ratio of 92.95%. Next, on student proficiency in class 5 and 8. Average marks scored on learning outcomes for students in class 5 is 54.69% and in class 8 is 44.58%. Another on children out of school. 2.97% of children in the age group of 6 to 13 years are out of school in India. 17 states or UTs have achieved the target of reducing this rate to 2%. Himachal Pradesh and Puducherry performs the best among states and UTs respectively. Next, on average annual dropout rate at secondary levels. 17.06% of school students drop out at secondary level in India against the 2030 target of reducing this rate to below 10%. 3 states, Himachal Pradesh, Punjab and Tamil Nadu and 2 UTs, Andaman and Nicobar Islands and Lakshadweep have already achieved the 2030 target. Next one on professionally qualified teachers. 81.15% of school teachers in India are professionally qualified for their job. The national target for 2030 is to have all teachers to be professionally qualified. Delhi has already achieved this milestone and not for us, Gujarat, Maharashtra and Puducherry. Next, about student-teacher ratio. 70.43% of elementary and secondary schools in India have achieved student-teacher ratio of less than or equal to 30. Roughly 7 in 10 schools in India have at least one teacher for every 30 students. The 2030 target is to have 100% schools providing at least one teacher for 30 students. Union Territory of Lakshadweep Islands has already achieved this target. So, we are looking at Government of India initiatives. As I have already said, here we will discuss only about important schemes and programs, but you could find the detailed ministry-wise sorted list from the material given. Please go through that, okay? So, Union Budget 2018-19 has proposed to treat school education holistically without segmentation from pre-necessary to class 12. To achieve this, a comprehensive program, Samagra Shiksha, has been included with the aim of improving effectiveness of schools and providing equal educational opportunities for all. It has subsumed three previously existing schemes like Sarva Shiksha Abhiyan, Rashtriya Madhyamik Shiksha Abhiyan, and Teachers Education. The objective is also to enhance use of digital technology in education through smart classrooms, digital boards, and direct-to-home channels. Digital initiatives like Shala Kosh, Shagun, Shala Sarthi are also helping to promote technology in the education sector. Sarva Shiksha Abhiyan, launched in the year 2001, continues to be India's main program for universal elementary education. The interventions under SSA include building of school infrastructure, provisioning for teachers, periodic teachers training, and academic resource support, making available learning resources for children like textbooks, computers, libraries, etc. To ensure equal learning opportunities for all, including girls and poor, residential schools for girls, as known as Kasturba Gandhi Balika Vidyalayas, have been set up, and local level accountability has been established by engaging with community-based organizations. The midday meal scheme is aimed at increasing enrollment in primary schools as well as improving the nutritional status of primary school children. The country moved to a right-based education framework with the implementation of Right of Children to Free and Compulsory Education, or RTE Act 2009. The right casts a legal obligation on the central and state governments to provide and ensure admission, attendance, and completion of elementary education by all children in the age group of 6 to 14. Also, to improve access to secondary education, Rashtriya Madhyamik Shiksha Abhiyan was launched in 2009 to achieve an enrollment ratio of 75% at secondary school level by providing a secondary school within reasonable distance of habitation. So, how India could achieve the target? Major one is by strengthening public education system in the country. Inclusion of pre-primary to secondary schooling within the RTE Act and financing the RTE Act is very important. The government should enact a law committing itself to devote a percentage of total budgetary expenditure on education. The law should provide two separate targets, one for the state and other for the central government. India should focus on skill-based education. India should provide space for Anganwadi centers. India should reward creativity, original thinking, research and innovation. We should get smarter people to teach. Periodic teacher training and academic resource support is very important. India should implement massive technology infrastructure for education. Public-private partnership and collaborative efforts should be increased. Rural education should be focused. Gender-neutral education has to be emphasized. Mahila Shakti Kendras to provide one-stop convergent support services for empowering rural women in opportunities for skill development, employment, digital literacy and health and nutrition should be done. Subsidizing professional courses should be increased. Make sports compulsory in schools and colleges. Educate parents, which in turn helps the students. Provide schools within a kilometer of walking distance. More investment is needed in educational scholarships, teachers training, school building and improvement of water and electricity access to schools. India should make available learning resources for children like textbooks, computers, libraries, etc. So that's it for today, and the next part will be released soon. So thanks for watching.